one of the most regulated molecules we have because it can be a real problem. There's vitamin D in it, calcitonin, parat hormone. As you all know, when you measured vitamin D in blood, lack of vitamin D is very prevalent. We don't get it through food. We don't get it in offices. We don't get it if we watch sunsets after office hours. So we don't get it if you're black and so on. Yeah. Check your blood levels because it's needed not only to prevent muscle weakness, and in that way it prevents you from falling, but it also prevents osteoporosis, hypertension, stroke, cardiovascular diseases, metabolic syndrome. It lowers, good vitamin D levels lowers mortality in metabolic syndrome by 80%. So it plays a very important role in diabetes also. Welcome, Marco. Bienvenue. Neurological diseases with like multiple sclerosis up to cancer, in breast cancer and prostate cancer, really have steady vitamin D levels, don't go up and down with the seasons. It's very important to prevent recurrences or it from happen. Well, the official American guidelines for people over 70 says take 4,000 units. You remember that we were at 200 units only 2-3 years ago or 4 years ago. So we were, this was homeopathy in the area of vitamins. That's what you need, and that's really is, according also to our experience, what you usually need in elder patients, also often younger. In the summer, if you go out, sometimes 1,000 units can be enough if you really get into the sun. This is the blood levels you should aim for, and there are some who recommend even higher. We are quite conservative in that. It's safe to take every day 4,000 units, even according to EFSA, so even as a doctor you don't get into trouble. Kids, 2,000 up to the age of 10, after that 10,000 daily. How it's made, you know, chemically it's made similar. It's cholesterol from wool, grease from the wool, irradiated by UV light. Vitamin K2 has a very good synergy with vitamin D. It's needed to incorporate calcium into the bones through the mechanism of osteocalcine. So you ask, why should I take the expensive K2? You don't need to. You also can take K1 every hour or eat really every hour a lot of green leafy vegetables. That's probably more healthy, but it's a lot of work. K1 and K2 do exactly the same thing, but the one has a half-life of 1 to 2 hours and the other of 72 hours. So the one gets active throughout the body over the whole time, and K1 is usually just briefly in the liver and then it's gone. That's why it doesn't have effects on your arteries practically at all. Dietary sources in Western diets of K2 are almost nil, little bit in old cheese with a lot of histamine. And like natto, the Japanese and Asian diets is very rich in it. So there are two molecules. We have the osteocalcine, which is like bone GLA protein, and we have the matrix, the connective tissue GLA protein. The one keeps the calcium in the bone, and the other keeps the calcium out of the vessels because it binds it and chelates it so it doesn't deposit. It's a very simple mechanism. It's a carboxylation of glutamic acid. And because of this simple thing, that molecule can bind calcium, this one cannot. So osteocalcine is completely useless unless it's carboxylated. Then it's a very good calcium chelator, basically. And osteocalcine has a lot of other functions on the pancreas, brain, muscle. It's just appearing how many functions it has. We know from studies that it is only the carboxylated calcitonin that prevents fractures, The other one is useless. So the more uncoupled exit, the more fracture you look into. And there are a couple of pretty large double-blind studies showing that with 180 micrograms of MK7, all trans MK7, you can delay the normal bone decline that happens with age. So here you see that you have a lot more uncarboxylated without and a lot less with K2, and you can see that the decline in bone density and structure is a lot higher in the placebo group, whilst the other group, but still it's going down, but it helps really to prevent it, but it's not a miracle cure that you have perfect bones after taking 2 months of K2. There's, what is this? Oh yeah, this is a lot of other studies with the same outcome. You can look at it in the slides. Here we have the matrix protein, which is expressed by smooth muscle cells. It's very important in the endothel to bind the calcium so that it doesn't deposit at the calcium phosphate in acidotic milieu, as we discussed previously. So with atherosclerosis, you have an increase of arterial stiffness. And after 3 years in the Verum group, you have an improvement of that, whilst a decline in the control group. So it helps to improve arterial stiffness, so the reactivity and the smoothness of your arteries normalizes. The stiffness is directly correlated with calcium. There are other indications. Interesting, especially is here kidney patients, lower progression of calcification. I said kidney patients have the most acidosis and they have the most calcification, therefore for them it's essential. And here a couple of other patients, after the age of 50, it's really good if you add to vitamin D always the K2. There are 2 ways to make it, by fermentation or by organic synthesis from plant raw materials like etheric oils, geraniol, farnesol. With the one, you get a lot of other stuff. Here you get pure organic, not pure, but all trans MK7, which is the one that has the biggest effect. We use high oleic sunflower oil. Basically, it's with olive oil. It's similar to olive oil, but it's not so oxidized like olive oil. It's very low in omega-6 and high in tocopherols. We add tocopherols in addition, especially gamma tocopherol, to stabilize it. And we've been doing that now for 7-8 years, and our long-term stability tests are really excellent, both for D3 and for K2. So the stuff is stable for 2 years in the bottle, which is not normal. Here the difference you see between K1 and K2 is that it's much longer and therefore it's much longer active. The K1 is quickly metabolized. So normal is that D3 really gets oxidized by light and by oxygen. And you have a really big loss of vitamin D. And this is a problem in supplements because you don't want to overdosage vitamin D. Normally, producers add a lot of vitamin to make sure it's still there at the end of the 2 years. You shouldn't do that with vitamin D, especially if you have these crazy people who take like 1 million units a day, what some do, or really high dose vitamin D treatment. There is a difference if you have like the double amount in it. So we overdosage only 5% and we are stable until the end. Because of that, we don't have a decay. We have more studies done on that. The oxidative decline of both vitamins is stopped, and that's why we stick with the oil. We have very good experiences, and we are not trying all these other things. We tried really a lot of oils like MCT and olive and so on. We found that to be best. All right, and it's made in Germany, like VW, but we don't use Chinese ingredients like everybody else, but our ingredients are from Europe, which is an exception. It's always, you find like made in on many things, which means basically somebody here put it into the bottle. What really matters is where your raw materials come from. So ours come from Denmark and Norway. K2 and D3, and they are pharmaceutical grade. And yeah, so that's another one I would like to stress. There's a long discussion, what is the normal vitamin D level? If you look at natural people, like these people still really running around in nature whole day, and they're pretty brown, that's their vitamin D level. That's what we have been also when we've been working outside all day. That's exactly what actually most experts really recommend, interesting enough. So it's not made up, but that's the amount you need for optimal health and optimal prevention. And that's what healthy, free living humans have. So either you can start as a Maasai, change your profession, or you rather take a supplement. So there are very complicated dosages for the usually very low patients you have. We have a very simple formula which works usually really well. It's you take 10 drops for 10 weeks of the 800 unit thing. So you take basically 8,000 units for 10 weeks. And thereafter you make a blood value control. And usually then it's okay. For maintenance, 2,000 to 4,000 is normally enough. People who are heavy, they need more because it's a fat soluble vitamin that disappears into the fat also. On a note of caution, do not go on these very high monthly dosages. Studies show clearly that this is it's not helping, but maybe damaging. The natural way is daily. We have been going daily into the sun. We've been making our daily vitamin D. We haven't been jumping to Mallorca, shooting up, burning ourselves, and then going back into the cellar again. That's not natural. And that's one of the worst things for cancers, this shooting up, falling down. Because the receptors in breast and prostate can't adapt. So this is the worst. That's why keep it steady. And yeah, if you're beyond 50, we definitely recommend vitamin K2. If you take 20 micrograms of K2 with every 20 micrograms of vitamin D, you get a good amount of K2. You can take more if you have already calcified vessels, but K2 is expensive. This is like a low-cost mineral version we recommend. The problem with vitamin D is the bad publicity from the time when you got it as liver cod oil, where nobody really knew how much is in it and how much to take, and you got all kinds of side effects like renal stones and renal calcification. We can do better nowadays. And for prevention, vitamin K in the value of 80 micrograms is fully enough. For treatment, it should be 180 microgram. We have here a huge list of our products with different indications, which you have in your folder. The PowerPoint are on your stick, but they probably have that sheet also separate. There you can see a plus is really very recommended, a 0 would be good, but it doesn't have to be, and so on. So it depends really on the financial situation of the patient, also how much he can invest, but the plus ones, they should be really taken in certain conditions. What we don't have here still really is the very big and important topic of allergy, histamines, and so on. But we are working on that so that we have an intestinal solution in the next 3 months. I think, let me think if I have anything here. What really helps a lot of people is Regenerat Immun, which has a immunomucose. Oui, oui. And Q10 Synergy is a very effective low-cost Q10 supplement, which has lecithin, improving absorption, taurine, B12. It has a lot of riboflavin, another respiratory chain coenzyme. It works a lot better than normal Q10 and is very cost-effective. I really recommend that to you. OPC, actually, we have it too, and it's a good antihistamine. It's one of the helpful things against histamine intolerance. OPC synergy, but alone it's not enough. It's supporting, and it's also helping with Wayne's, the typical problem